Okay, so this is my video for the skill Nmes, and today I'm going to be performing it on my patient Marissa's right quad. So hi Marissa, my name is Kia and I'm an OT/PTA student at Canada College. Today, Mabel, your physiotherapist, has asked me to perform what's called Nmes with you. The purpose for Nmes is primarily for muscle re-education. So you might have had an injury or a stroke or something to your leg recently, and that's just teaching your muscles to help work together and contract all of the fibers to help you be strong. So to do that, we use this little machine right here. It provides electrical stimulation through these 2 cords onto 4 pads on your leg. And basically, you're going to feel pins and needles, some tickling, and we're going to be looking for the highest tolerance that you have. What I'm going to be looking for is basically your leg is tingling so much it's almost fused. Of course, to your highest tolerance. So once it becomes too intolerable, I need you to communicate that to me. After we set that up, I'm going to leave you be for about 10 minutes with a call bell, and then we're going to come back and finish up. Do you have any questions before we get started? Incredible. So some of the risks that you could face right now are you're at risk for surge, electrical shock, possibly some skin burning or things like that. But to avoid that, we do have all of our machines serviced very regularly. As well, I'm here, I've been trained, and I'm going through the process with you slowly. And when I leave you, I'm going to instruct you to remove the black top part of the cord out of the machine entirely, because that will immediately remove any charge. Is that okay? Perfect. So I'm just going to ask you to go ahead and lay down.
I'm going to put my head there because it's my right.
Yes. That's okay.
Just a warning, when I did this with Tana in lab, my quad did not move. I'm broken.
So I'm going to start off by draping you, if that's okay with you. So to do that, I'm just going to take your short and tuck them up. You're fine. So the next thing that I need to do is I need to take the machine and make sure that it's set at the appropriate parameters. Okay, so what I'm going to do is I'm going to start off by connecting the leads to the machine as well as to the electrodes and then to her leg. So
So for that, I'm looking to make sure that there's no open wounds, irritation, or anything like that. That could just impact your treatment process. So that's going to be a little bit cold. I'm really sorry about that. And then I'm just looking for my roll of tape. Okay, I guess we're going to do without the tape. So go ahead and say perfect, and so we're using the big electrodes just to make sure that we're getting the whole muscle belly. Okay, once the electrodes are applied accordingly, I'm going to start by increasing the intensity. So we're going to go until you feel it, until you feel your muscle activated, and I'm going to be looking for some contractions. So, how does that feel? Do you feel anything yet? Do you feel something? Perfect. Okay. So I'm just going to slowly continue to turn it up a little bit. I'm not going to turn it up like 10 seconds. Yeah. Is that okay? Is that too much? Do you want me to go up more? Do you think that that's as high as you can tolerate? Yeah. So when it goes on again, I'm just going to increase it by a tiny bit more and we'll see. Just because, like we said, it is the most effective when it is at the highest point. Okay? Is that okay or is that too much? Perfect. So now that we've done that, we are going to When it's off on the next time, we are going to increase the amplitude. And so we're looking until we see almost fusion or increased tapping on the muscle. So, okay, and I'm just waiting for the charge to start. There, to start. It says it's charging now, sorry. Perfect, so we'll try that and see. Okay, so I am starting to see some tapping. How does that feel? So I do see her leg contracting a little bit there. Do you feel as though we can increase the rate a little bit? No? Okay. So she said that that's the extent of her comfort and her tolerance right now, so I'm going to let that sit for 5 minutes before I come back. Marissa, just so you're aware, if it becomes too unbearable, I need you to pull out both of the black cords and then ring your call bell. Oh, which one I will make sure to leave with you, okay? Perfect. Is it that I have it too high, or is it just no, I have to be rolling? Okay. I just want to make sure that no, I'm trying to be quiet for the sake of you. I appreciate it. Oh, I didn't show that. Okay, well, that's fine. Is it off? Yeah. It's not off, but if I'm really, really low, I'm going to plug it back in so that I can finish. Setting a charge, but you should be fine. Yeah, no thing.
Okay, and so there's the parameters that we have set, and like I said, we're just going to leave that for about 5 to 10 minutes. Hi Marissa, how are you feeling? Good, I'm really glad to hear that. So your treatment is over, you've sat really well, and when I checked on you earlier, everything seemed fine. So now I'm going to go ahead and start to remove the electrodes for you. And it does look to me as though you, as though it went well. It doesn't look like there's any redness or irritation, anything like that. So I'm really glad to see that. And how do you feel? Good, I'm glad to hear it. Perfect, and then I'm just going to make sure that I clean her up appropriately. We'll be back to see you at whenever your next session scheduled with the physiotherapist is. And I'm also just going to be making sure that I give her a cloth to clean herself up.